Hello friends, welcome back to Cortex YouTube channel. In this video, I will talk about causes of secondary hypertension. As you all know, the incidence or prevalence of secondary hypertension is around 10 to 35% in all hypertensive patients. The exclusion of secondary hypertension before making the diagnosis of primary hypertension or essential hypertension is very critical and crucial. For that you have to know the causes of secondary hypertension. They are very easy to remember. I have made an easy mnemonic for that. One is, you can remember them by cropped is mnemonic. Okay, CROPED, where C stands for chronic parenchymal chronic renal parenchymal diseases. So what are these chronic renal parenchymal diseases? Like where glomerulonephritis, interstitial nephritis, and polycystic kidney disease. Next, okay, there are so many causes like CKD, chronic pyelonephritis. So all these are causes of chronic renal parenchymal disease causing secondary hypertension. R stands for renovascular disease. Renovascular disease, like renal vessel stenosis. So what are the causes for renal vessel stenosis or renal artery stenosis? You can remember them by acid. Okay, A stands for atherosclerosis. Then C stands for compression from external, outside compression like tumor or something. I stands for, what is I stands for? I stands for inflammation like vasculitis, or it can be idiopathic also, and D stands for dysplasia. Dysplasia means your fibromuscular dysplasia. So these are the causes for renovascular disease causing secondary hypertension. Then in the mnemonic, O stands for obstructive sleep apnea, which is one of the most common causes of secondary hypertension. P stands for primary hyperaldosteronism, Con syndrome, which causes like sodium and water reabsorption, so volume dependent hypertension, secondary hypertension. Cropped, E stands for endocrine. E also stands for ethanol, chronic ethanol abuse. Endocrine like your hyperparathyroidism. Okay, let's come from the top. Pituitary, we have acromegaly. Okay, thyroid, we have hypo or hyperthyroidism, thyroid disorder. Then parathyroidism, hyperparathyroidism. Then what else we have? Cushing's syndrome. Coming to congenital adrenal hyperplasia. Then one more adrenal pathology is pheochromocytoma. So these are all the endocrine causes for secondary hypertension. E also stands for ethanol. Okay, ethanol. Then D stands for cropped. D stands for drug-induced secondary hypertension. So what are these drugs which causes secondary hypertension? Your NSAIDs will cause hypertension. Corticosteroids will cause hypertension. Then what are the other drugs? As you all know, your sympathomimetic drugs will cause hypertension. Then erythropoietin, your erythropoietin supplements or erythropoietin drugs will cause secondary hypertension. Okay, calcineurin inhibitors will cause, tyrosine kinase inhibitors will cause and especially MAO inhibitors. Okay, that cheese reaction, that's also is a drug induced hypertension. So these are all the causes for secondary hypertension which you have to rule out before making the diagnosis of primary hypertension or essential hypertension, because the incidence are prevalence is very significant. It is the 10 to 35% of the all the hypertensives will have one of the causes for secondary hypertension, that you have to find out and treat that. Okay, so these are the causes of secondary hypertension. Hope you find this video useful and this mnemonic useful. Please include this mnemonic or remember this and use it in your daily day-to-day practices. Thank you.